What if I told you that thousands of years before modern hospitals, before anesthesia, and before sterile instruments, surgeons in ancient Egypt were already drilling skulls, stitching wounds, and even writing medical manuals? You might think that sounds like a wild exaggeration or a headline cooked up for TV. But stay with me, because what you are about to hear could completely change the way you see the ancient world. The Egyptians were not just pyramid builders. They may have been the world's first practical surgeons. Before we start, hit the like button if you love uncovering myths versus reality, and subscribe for more deep dives into ancient mysteries. Now let us cut straight into the story. For centuries, Egyptian medicine was seen as nothing more than mystical rituals. The stereotype is always the same: priests chanting spells, waving incense and rubbing honey on wounds while hoping the gods would do the healing. To many modern thinkers, Egyptian medicine sounded like a mix of magic and superstition, not something you would trust if your leg was broken or your skull was cracked. And yes, Egyptians definitely leaned on magic. They believed that disease could come from spirits, curses, or angry gods. Medical papyri are full of incantations meant to banish evil forces. But here is the surprising twist. Alongside those spells are some of the most practical and advanced medical instructions of the ancient world. One document in particular stands out: the Edwin Smith Papyrus, dated around 1600 BCE, but believed to be copied from even older texts. Unlike most medical writings of the time, this papyrus does not read like a prayer. It reads like a trauma surgeon's manual. It describes broken jaws, dislocated shoulders, fractured skulls, and how to test whether a patient will survive. The writer organizes the cases step by step. If you examine a man with such an injury and he cannot move his legs, this is a disease not to be treated. That is not magic, that is triage. That is clinical thinking thousands of years ahead of its time. So the question is this: was this just theory, or did they actually perform real surgery? Archaeology has given us the answer. In 2018, researchers studying skulls from the Nile Valley made a discovery that shook the field. Several skulls showed evidence of trepanation, which means drilling or scraping a hole into the skull, usually to relieve pressure after head trauma. But what made this shocking was not the holes themselves. It was the healing. Many of the skulls showed bone regrowth, meaning the patients survived the surgery. These were not random rituals. They were successful medical operations. Other skeletons tell a similar story. Some bones show clean fractures that were carefully set and healed straight. Some ribs and limbs have sharp cut marks that later healed, evidence of amputations done with precision. Even more fascinating are mummies scanned with modern CT machines. Some show signs of dental work, with cavities filled using resin and honey. One mummy revealed an artificial toe made of wood and leather, crafted to fit so well it allowed the person to walk normally. That is not symbolic magic. That is medical engineering in practice. But how could Egyptians operate without modern instruments? The answer is simple. They had their own surgical toolkits. Archaeologists have uncovered bronze scalpels, obsidian blades sharper than steel, needles, probes, and even forceps. Some of these instruments look surprisingly similar to what you would find in an operating room today. Obsidian is especially fascinating. Even now, modern surgeons have experimented with obsidian blades because they cut cleaner than metal scalpels. Imagine that. A doctor in ancient Thebes with a shard of volcanic glass might have made smoother incisions than a 19th-century European surgeon with steel. They also used a wide pharmacy of natural substances. Honey, which modern science confirms, has antibacterial properties. Moldy bread, which at the time must have looked odd, but produced effects similar to penicillin. Willow bark, the natural source of aspirin, used for pain relief. They may not have understood germs or chemical compounds, but through observation and trial and error, they built treatments that worked. Let us break it down clearly. Myth 1 says Egyptians only relied on magic and not real medicine. The evidence says otherwise. The Edwin Smith Papyrus is filled with systematic case studies, and skeletons show healed injuries that required skilled treatment. Myth 2 says surgery before anesthesia was impossible. The evidence shows they used wine, opium, and herbal sedatives. These were not perfect, but they dulled the pain enough to work. Myth 3 says ancient doctors had no idea about infection. The evidence proves they used honey, copper and resin, all substances with natural antiseptic qualities. Patients treated this way would have healed with fewer infections than expected. The bottom line is this: Egyptians may not have known why something worked, but they knew that it did. So did Egyptian surgery actually work? The answer is yes, often shockingly well. But of course it was not perfect. Many patients likely died from infection, blood loss, or untreated complications. And magical rituals were always part of the process. They did not separate medicine from religion the way we do. A doctor could also be a priest, treating the wound while reciting prayers. Still, the evidence is overwhelming. Ancient Egyptian medicine was a blend of ritual and real science. They pioneered techniques that influenced Greek and Roman medicine, and through them shaped the history of healing itself. Think about this. When you step into a modern hospital, you expect doctors to diagnose, treat, and triage. That system was already described on papyri more than 4,000 years ago. So the next time someone dismisses ancient people as clueless about health, remember the trepanned skulls, the healed fractures, the prosthetic toes, and the glowing papyri that read like training manuals. Egyptian surgery may not have looked like Gray's anatomy, but it worked often enough to survive in memory and influence centuries of medicine. And maybe that is the real lesson here. Science does not appear overnight. It grows out of trial, error, and even magic. If you enjoyed uncovering this truth, hit the like button, subscribe, and share this video. And I want to hear from you. Would you trust an Egyptian doctor from 3,000 years ago to treat your broken arm? Let me know in the comments.